Hi everyone, I'm Ava from Biomdcare, and today I'm going to share with you how we protect women's health with AI precision medicine. In our vision, we believe that everyone deserves an equal chance for a healthy life. And there are many diseases that women are at much higher risk than men, but the related disease knowledge and issues are often ignored. And even now, as the concept of gender equality gradually matures, the women's problem of their health issues are still often ignored. So that's why we will provide simple and precise AI medical devices to improve their health and to make them feel healthy, confident, and vigorous. And that one of our solutions is our disease AI screening kits. That includes uterine cancer, ovarian cancer, cervical cancer, osteoporosis, sarcopenia, leukemia, and breast cancers, and etc. And there are 4 key elements that makes our disease AI screening kit special. The first one is that we have our own self-developed AI algorithm that gives us high flexibility and autonomy to control our AI training. And then that our methods are complies with clinical medical guidelines and evidence-based methods. And also that because we develop our own AI model, that we have high ownership through our AI to make it into the market. And also we have high degree of mastery of IRB application and clinical investigation evaluation designs, and also the medical device listing and regulation. That makes our product has a higher possibility to go into market. And so today I'm going to talk about how our disease AI screening models works in both cervical cancer and osteoporosis. So for cervical cancer, that it is the 4th most common cancer in women. And worldwide, cervical cancer has an estimated of 570,000 new cases in 2018, and it is representing 7.5% of all female cancer deaths. But it is one of the most successful treatable forms of cancer if it is detected early. So how to detect early? That one of the most recommended screening type tests recommended by WHO is the conventional pap test. And according to statistics, regular pap test screening decreases cervical cancer incidence and mortality by at least 80%. And the pap test includes a slide smear analysis. And before, it takes about 15 to 25 minutes for a lab technician to go through a slides. And with working 8 hours a day, usually they have problems of eyes fatigue and also poor efficiency that leads to difficult to maintain the quality. And then sometimes they face 15.6% to 40% of false negative rate. But our assistant comes into play. We help them to analyze the smears and also help them to annotate the region of interest of they want to. And also we can even generate the report for them so they can increase their efficiency when they're analyzing the smears. And also we help them to manage all the files that tens of thousands of files generates every year for them. So our system can help them manage the storage of the files. So this is the image of our assistant that we help them to view the smear slides, to annotate the region of interest of their slides, and so they can also scan through the image very quickly and help them to generate the report. And also, as you can see down there, that we help them to manage their storage of files. So the lab technicians can increase their efficiency and furthermore to increase the preciseness and the accuracy of their analysis for every woman which they deserve. And the next one is osteoporosis. Osteoporosis is a systematic chronic disease, and more than 200 million women worldwide have osteoporosis. And the threat is, in Taiwan, osteoporosis is a serious global problem that's second only to cardiovascular disease. And the prevalence of osteoporosis in Taiwan is 28.3% for women and 23.9% for men. And there are 1 in 3 women over the age of 50 will experience osteoporotic fractures, while 1 in 5 men will do. And in world, osteoporosis causes 8.9 million fractures annually, and then it is a similar or exceeded the common number of cardiovascular events and breast cancers. And the mortality rate, because if you have osteoporosis, there is a very high chance that you will experience a femur bone fractures. And the osteoporotic fractures, the mortality rate within the 1 year after the hip fracture is as high as 20 to 24%, which is very scary. And then osteoporotic fractures happens 1 every 3 seconds, just like this. And that's 1 more. So it is very important that we know, let people aware of the osteoporosis issue, and then let them take action earlier. And these are the 2 current methods of osteoporotic detection, which is the quantitative ultrasounds that you can see a lot in the pharmacy for the ankles, and also the dual energy X-ray absorptionary, which is called DESA. And it is the WHO regarded as a gold standard for osteoporosis screening. But there's a problem that usually the ultrasound is very fast, very easy to deploy, but it has a problem with accuracy. While the DESA is very accurate, it's a golden standard, but the problem is not a lot of hospital has it, and people come in, they need to take money from their own pocket to get a screening, and maybe they need to wait for a month to get a scan because they have to wait in line for the machine. So that's why we have our solution. That is, the overall detection cost is low, but it has high accuracy. That our tool is a tool that uses hip X-ray to detect if you have the risk of osteoporosis. And it's a good tool for hospital for both outpatient and also the community service, because we utilize the X-ray machine, that we can use the X-ray bus to go into the community to detect people to see if they have osteoporosis without them knowing. For the consumer, it's only 6 seconds for a healthy life. They just go onto the X-ray machine, 1 second done with the X-ray image, and then our AI can do analysis on the osteoporosis risk. And this is our image that once after, like 6 minutes after you take the X-ray, and then our AI will automatically detect analyze the risk of our osteoporosis and generate a report. So this is a great tool for the hospital to provide services for their patients. And this is one of some of the image that we have done before, that we use the mobile X-ray buses to have, that we provide service for the elderly, for all the women, for all the men, that they can come here to take a screening and then see if they have the osteoporosis risk. And then there are some these are some images. So for today, as we believe that every woman and actually everyone deserves an equal chance of healthy life, it is very important that you can take care for your women in your life and also yourself. And we believe that everybody will be healthy, confident, and vigorous. And thank you.
Hello, good afternoon, everyone. I'm Brian from Cloudmed. We focus on the mobile health solutions on wellness, fitness, and lifestyle. And we have a very successful proven record over the world. Now we have selling over 20 countries and have a 20 million revenue in this year. And you might be very curious how big the market is. Actually, in the United States, there are 90% expense is on a chronic disease like diabetes, and obesity and hypertension. So this market is very huge and deserve us to put resource into this market. So, but not only the elder people has the healthcare requirement, but also on the baby and the child and also the adult. They have maybe to avoid sudden deaths and also emotional control and like stress control, and even for the healthcare. So every stage there has a healthcare requirement. So how to manage the health? Actually, we did the data management. So from the starting, we collect your health data from your body, and then we use the AI technology to pre-screening your every kind of data and to screen if you have the disease. And then we did a pre-correlation to find out potential disease. And then we want to predict your future trend in the next 2 or 5 years. And finally, we will give you a suggestion and actions to improve your health. So the concept is very simple, very simple. But not only just the concept, we provide a very unique experience on your mobile. So we provide the app. Very simple, very useful to help to management your weight or even your heart health. And not just the app, we provide a total solutions like the tool. We have the report and the coach bot and also the content for your billing. And also we provide the app, the software, and the service, all kinds of the solutions to improve your health. This is very unique in Taiwan. So actually now we are a pioneer digital health in Taiwan. And this is our benefit, not just to improve your health. You can see your real numbers going down, like your blood pressure. You can see this is our users. They use 1 year to measure his all kind of index, and his blood pressure is lowered down by 5.3% and 4.2%, and also his heart rate is reduced down to 12.2%. So the benefit is very obviously. So you are very happy to spend small money but get a lot of health. So you can go to our booth over there to experience our products. Okay, it's very cheap and very useful. Okay, our business model is very simple. You can buy very cheap hardware and pay very small money, maybe $1.99 to experience advanced analysis and all kinds of reports. So it's a very simple business model. So now we really a #1 company in digital health in Taiwan. Okay, this is our achievement. Our company only 32 months from the beginning, but we achieve a lot of good results. Like we have 70 million revenue, and we have 1 million big data in our cloud systems. And we're selling over, now it's selling over 70 countries. This is 2 months ago, but now we're selling over 70 countries. And we have the over 100% growth every year. So we are very have very impressive results. So you can contact us, our audit center in Hsinchu, and manufacturer in Tainan Science Park, and our commercial office in the United States. Thank you.
Hi everyone, my name is Gemma, and it's an honor to be here to have you some of our introduction. Today, the topic I would like to share is how we use our AI video-based vital sign monitoring technology for safe return to work for enterprises. As we all know that Taiwan is the best country preventing COVID-19. This is our honor and so proud. And however, this made most of us cannot feel the same way like
how panic or how anxious that those people in the suffering country. So before we start, I would like to invite you to imagine if we are surrounded by those confirmed positive COVID-19 cases. Here and there are so many positive cases. Under this condition, how can we make sure and report the working environment is safe becomes important. Okay, the outbreak of COVID-19 last year was so quick and with no any antidote or vaccine. And 86% patients have at least one of these symptoms, such as fever, which cause the higher body temperature higher than 37.8 degrees Celsius. And other than temperature, you can see from the presentation, the heart rate beat will increase more than 100 ppm. So, which means heart rate beat is another indicator worthy to be monitored. Okay. So, therefore, the temperature is not the only focus. So, since the heart rate beat is worthy to be monitored and highly suggested every day, how will you measure it? These are some most traditional and current methods for vital sign measurement. As you can see, these are like traditional medical devices which may cost you time to set up and cost you quite a bit of money to buy. And sometimes the heart rate watch or they are wearable or contact-based devices, which will make you feel less comfortable when measuring. And even for enterprises, those individual devices are not easy to collect all the data. Therefore, this is what we would like to solve. We are FaceHeart. Get your face and measure your heart rate. With our sophisticated image processing algorithm, this app can help enterprises collect the data easily and have the valuable data to monitor their employees' health condition. And for employees, it is an easy tool for mobile health. It can be used anywhere and anytime for a daily personal health monitor. Okay, from this page, because so many people are thinking that our technology is so magic, because without any touch, any contact, we can measure the heart rate. So this is our core technology. By RPPG, this is our basic theory. The R stands for remote, comparing to traditional like Apple Watch, which is the wearable and contact devices. They are using our PPG theory. So by using a single camera with our sophisticated image algorithm and AI technology, all the images will be converted and transferred into digital raw data. And all for our patented algorithm. And afterwards, the images will be discarded and no longer exist, so there's no privacy issue. Currently, our technology can measure heart rate variability, respiration rate, stress index, and blood pressure will be available this third quarter this year. To ensure the accuracy, we have collaborations with the top 6 hospitals in Taiwan, including Taiwan University Hospital, Taipei Veteran General Hospital, and Changchun Memorial Hospitals. And yet, we have collected more than 2 million minute data to optimize our solutions. As we all know, that social distancing is the most effective way to avoid COVID-19. And so the trend and requests for remote health and telehealth are boosting. Even FDA took actions and published the draft guidance for AI-based software as medical devices in January this year. We are preparing for application at the end of this year. So here we divided our solution into two business sectors. One is non-medical use related. The other one is medical related user. You can see from this page. Our solution can be integrated into app as value-added services or embedded into hardware as risk assessment. Okay, this is our demo app, the user interface. With a single press, without any further contact or setup, we can measure your heart rate and heart rate variability. After, you can see the flow here, like a 40-minute calculation and measurement. The result can be recorded, and the history can be stored in the app or upload to the dashboard that enterprise can monitor. Even this app can be integrated with G sensor for temperature measurement as needed. Okay. Okay, here's the demo of our dashboard that enterprises can use this dashboard to do the further analysis. Whether the record is on-site or off-site, we can have risk assessment or trend analysis or abnormal alert for future epidemic use as well. As we are a software company, we have support different platforms. For smart devices, we support Android and iOS, and for the devices, we can support Windows or Linux for depending on your scenarios. And as you can see, these are different demonstration from this page. You can imagine that just like the same technology with different demonstration, like the same person with different outfit. Okay, here's another demonstration of how we embedded into different hardware. These examples are the contacting OEM and ODM manufacturer. Like mirror, we can place in the washing room or in the social hall. And the TV can be placed in the living room. When you watch TV, you can measure your vital sign without any contact. And the spine bag can be used in a gym. And a smart speaker can be used for telehealth. Okay, the Biocam is another demonstration of our solutions. This is a mock-up of that we integrate and embedded our solution into the little box. And the camera can be a regular camera like Logitech C920. And with our strategic partner, MTK's chip, we have made this like a small measurement box. Okay, here's the scenarios that it can be manual. You can place the Biocam on the table and you can measure it, or you can tear it apart and then put a camera on the TV, and also you can measure it without any contact. And all the information can be transferred into the app. You can do the personal analysis. Okay, and since we support no matter what kind of service provider you are, we have offered different categories. Service software, we provide like SDK or APK, and we also provide chipset to integrate it into your hardwares. Okay, here's our team. Dr. Wu is our professor. He's a EEE in National Chiao University and leading our technology development. And Jerry is our president. He has success in leading us with his 20 years experience towards NASDAQ. And Dr. Morris has more than 10 years experience in vehicle. Okay. Here's some of our previous news that we have collaborations with fintech use. Our company have established last year, but actually we have more than 6 years developing in image processing. Here's some of our patents. Okay, thank you for your listening.
Hello, everyone. I am the GenkiTek CEO. I'm CT Shen, and I'm very happy to be here to introduce our GenkiCam, an AI baby camera. And an AI baby camera we have already shown in the CES 2020, and in this year we add the thermal module inside our camera. Okay. The first, we talk about the need of the baby camera. According to the CDC in the United States, that they say 3,500 people, 3,500 baby they die they die while they sleep. So we want to design an AI baby camera to detect the dangerous event for the baby. Okay, and this is some demo about our baby camera. We detect the baby is happy, or baby is throw up, or vomiting, or they rolling over, something like that. Excuse me, can I show the video? Could you help me to click this? Oh, okay. Okay. Okay, so as we can see here, the baby is quite happy right here, and then he throw up, and we want to detect these events. And can you help me to show the video right here? Thank you. And okay, take this one. And this is the baby. He was happy, and then he throw up, and the throw up may cause dangerous event. So our baby camera to detect this event and then send the message to the parents. Yeah. Okay, and let's show how it works. The first day we collect a lot of dangerous events image, and then we training them to have a neural network, and we optimize this neural network and then put into our baby cams. So this is currently we collect more than 1 million babies' image, and then we use AI to train it. And our baby cam right now, we can also detect the temperature. So if baby is the fever or even COVID-19, and we can detect it and send the message to the baby, to the parents or their baby sister. And the core technology of our company is we are good at tuning the neural net. So as compared to AlexNet, GoogleNet, and VGGNet, they are quite big net, but we compress it and make it very, very small and very high accuracy, and then we can put it into the camera, and then we can inform the parents. So we use this DNN, small DNN, to detect dangerous event, and then we use the communication to inform the parents. So we have some competitors such as Biomdcare, and they use a sensor pad to detect the signal, and they can detect the baby is breathing or not. And we have the competitor cube balls. They also detect the baby rolling over. But our GenkiTek right now, we can detect vomiting, emotion, breathing, and temperature sensing. So this is our very key feature. And our product may go to the market in this June. This is some slide when we are at CES 2020. That is a GenkiCam baby AI camera that we show the AI only right there. But currently we have already added temperature sensing. Yeah. Previously we only collect 500,000 baby image, but right now we have already collected more than 1 million baby image. So our AI is stronger than the others. Okay, and this is also the demo right here that we use the AI chips right now. And you can detect the baby is smiling or even the vomiting. So there's our booth, so you can join us and to check it out. Yeah, the whole algorithm currently is on the AI chip. So actually, we have some customers. They are the baby cam makers. So we share the software and they use the AI chip and to make their products. And this is a thermal sensing part that we have already co-op with many thermal sensing company. So this is one of them that currently we can detect the image, but the raw data, they are quite noisy, but using our technology, we can denoise it and make the whole image smooth. But currently we give the only one temperature value, but in the future, probably in the next year, we will give you the whole thermal image next year. And that says that we not only transmit the RGB videos streaming, but in the future, we will transmit the thermal image as well. And let's see the market of the baby camera. And the market is quite good right now, that the CAGR is go to 10.75%. And the new advanced baby camera should give more information, such as activity, which means actions, face cover, rolling over, something like that. And the health information, such as breathing, heartbeat, and also detect the temperatures, surrounding temperature and baby temperature. And in the future, we will put this feature all inside our new AI baby camera next year. But this year, we give you the face cover, we give you the vomiting detection, and we give you the temperature module. And the market in the East Asia, and as we can see, that Chinese have the 25 million newborn babies in a year, and in the United States, it's 3.8 million baby per year. So the market is quite big. And if you look at Indonesia, there's 1.6 million baby every year. Vietnam 1.3 million, and the Philippines is 1.7 million. So currently we solve the software and cooperate with AI chips company, and we are going to this market right now. So our business model is helping the customer to get into the AI film. We co-op to the AI, we co-op to the hardware or the original baby makers and make their baby cam becomes an AI product. And we also try a new product to bring the innovation. So we will go to the crowdfunding for the very new baby camera, such as the temperature and something new kind of the baby cam. So our key partner is a chip company and PC company and the sales channel, and basically our cost is from our R&D. And this is our team, and I am CT Shen, and H. Agent is our AI director, and Benson Huang is our IoT director, and Ariel Huang is our production and R&D manager, and Andrea Xie is our sales. She's our sales, and we have also have some software geek. So this from our company. Yeah. So I also have some appendix that if you to see the hyper cycle for the AI, that currently the edge AI is on the mountain. So that means that we have a lot of opportunity in these 3 years. So if we look at the trends of the imperators, that the Gartner said that AI and the edge AI and the DNA is currently right into the very hot zone. So we have a very good opportunity, and we are also looking for the cooperation in the investment. So if you are willing to cooperate with us, then please feel free to come to us. And we also deal with some new application, and they are all inside the edge AI computing. So if you have any further information, then feel free to come to us. Yes. Thank you very much.
Hello everyone, my name is Zhang Huang. I'm the founder and CEO of OpenAIFab. And actually before I start, I'd like to have a question for you guys. Are there anyone who doesn't speak Chinese? Or who doesn't speak Chinese? Okay, okay, then I'll do some English. So today I'm going to present you some of the medical AI applications. And so here it comes. So some of a short introduction of our company and our past history. So we were founded in like May in 2019, and during that year we won actually two prizes. One is the first prize in the AI Go competition, and the other is the second prize. And last year we also actually became the AI Go mentor, and the mentee team actually won the first prize in AI Go as well. And also for ourselves, we joined another competition called AI Plus contest. It's actually held by TCA. And there we also won the champion there. And for the bottom right, this year we're also making some online courses for the AI for beginners. And this is held by Tibami, and it's going to be launched in, I think, April 6th, and the first day after the long upcoming weekend. Holidays. So, okay, so we do medical AIs, and when we say so, we mean it. So some of our photos with, for example, on the top left, that's the principal of the Kaohsiung Medical University, Zhong Yuzhi Zhong Xiaozhang. And we also talk a lot with the Makai, a nursing school, Ma Jie Chen Xiaozhang, and also we discussed several like AI cardiology products with Qi Mei doctors. And on the bottom left, there's an AI medical report, a coming event. There's a 6-day event, a pretty big event, and I'm also one of the speaker there. And we talked with the vice principal of the Furen University as well, and with the Datong Hospital. And so we were founded about two years back, and very soon we signed 2 contracts, and we did one of the auto hair, 法丝去背, and the other is actually apply AI to the law industry. But right now, we're all focused on the medicals, and we work with the hospitals and doctors a lot. And at the end of last year, we were selected to the innovation to industry, I2I, 资育 in Nangang. And very luckily, and we were also chosen to be part of AI50 here today. And what we do mainly is for medical AI and mental AI, medical AI and mental AI. So one is for the medical imaging, and the other is for mental health. So what we're hoping for is that OpenAI could be some of the extra hands and extra eyes for the doctors to help them do like surgeries or like do some like image recognition. And for the mental health part, it's actually going to be a very emerging market and growing very, very rapidly. And we are going to apply some of our voice recognition and NLPs and also the facial recognition, emotion recognition directly into the mental health industry. So we did a lot of medical applications with hospitals like Qimei. We did the LVG, the left cardiology application, and also we did a quite interesting one is for the Da Vinci operation, 达文西手术, with Taipei Medical University. And with Makai, we actually applied AI for the OB and gene applications to monitor the first 1,000 days for babies. And so this is for the mental AI. This one we actually collaborated with Taiwan 自杀防治学会, TSOS. And this is actually one of the first AI application applied onto the suicidal prevention. So what we did here is actually we crawl the data from like the PTT depression board, PTT 忧郁版, or like D-card emotion board. And from there, we got all the data there, and we built an AI model that could recognize the suicidal like risk. And with that, we are able to kind of like embed this with like the D card, and so that all the online messages could be actually screened, and actually if there is something like risky, someone could cut in and help. And this is also an interesting AI application. My mom herself is also a Parkinson-like first degree. And so we know that for the Parkinson disease patients, the first thing that patients do is that they draw like spirals. And if there is some like a shaky or like a inconsistent like distance between the circles, the AI could detect that easily because of the technology of the image recognition, CNN, is very powerful in this. And also what you can see here with the like yellow and reddish like color is the heat map. That is the cutting edge of explainable AI, AI. Explainable AI. That means that the doctors not only get the results from the AI, he can also know why AI produced such a result. So for those like with the red areas, it means that the areas that AI is focusing on. So AI can be also applied to the infantile paralysis. So like for those like patients, horse riding is actually helping them because it actually cures their like backbones. But on the other hand, it has to be correct, right? So what we do here is we use the pose estimation, and with the input of horse riding like a patient, you can detect that the different body parts, and then calculates like how balanced or maybe the straightness if basically the horse rider is doing the correct thing. So the last thing is that we are doing medical AI and mental AI, and we're doing the pre-A round investment. And thank you very much.
Hello everyone, so I'm Yashin Chu from UltronSMART, and today I'm going to share with you that how UltronSMART as a IoT company sees this healthcare business and how a healthcare can blend into a smart space. Sorry. So as we all know, this population is aging, and most of the elderly people, they are living on their own or solely with their partners. And this, where they live, like once if there are accident happens or we didn't pay a lot of attention on their physiological measurements or health conditions, that's where this tragedy happens. So ideally, we hope that the space where they live in can help with those problems. So the idea is to decrease the helpers' work to increase the self-care ability of the elders, so they can have more accessibility to how to control the environment. They can make their environment more suitable for their preference, and also maybe control the environment by a voice control or the apps, something like that. And via those, they can be more independent and confident with themselves and live with more dignity. And of course, the ideal like smart space for like a care home. If there's unlucky like accident happens, there will be notifications for their family members so they can take actions in time. So a good smart care scenario should take care of not only the living environment, which means the space, but also the people who live inside. But that means like every device related shall be connected to each other and can be monitored and controlled in a unified platform. But that's also what we call the IoT, the Internet of Things. But we all know that the IoT, the current IoT market is not like that. It's very fragmented. Most of the people who want to get inside this market face a lot of difficulties. Like for hardware manufacturers, they have to spend a lot of time or cost on building their own IoT devices. And since there are not a lot of brands who can afford this cost, the service providers don't have many options on the device they can use. So they cannot really build a preferred solution for their customers. So there's no device and there's no users. There's no data as well. So as a connectivity expert, UltronSMART believes that the IoT is the future based on collaborations. So we hope that all the hardware manufacturers can focus on their specialties and Ultron will help with the rest, which means the connectivity technology. We hope that, so now we have developed one smart module that you can embed it to the hardware that can make instant upgrade to a smart device. And also we have our patented connectivity technology that you can use one click to connect all the devices in your smart space. No need to set up individually. And also we have one unified platform to monitor everything, cross-brand, cross-devices. And all of these are under our patented telecom-grade encryptions. So the process is like this. We have our module with our software service, and once embedded on the hardware devices, those hardware devices can be transferred data to our app and platform. Whether you're users or the service providers, you can check, you can control and monitor all the devices and network on the unified platform. We also work with voice control systems like Google Home. So basically, you can use a voice control like Google Assistant or Google Home app. That allows more and more accessibility to the environment control. And for the users, the user experiences can be more unified, and there's no other integration work needed, and that allows more flexibility. So the same thing can be applied on the assistive devices. We have worked with brand partners doing body composition measurements and blood pressure measurements, and also the thermometers. So once the users use these assistive devices, the data will be directly transferred to our app and our cloud. So still, the users can control and monitor all the things in one app and one platform. So, and also we have worked with more than 30 brands of home appliances. So the users can have more options and to build their own smart home, smart space. So there's no need for them to pay extra work on how to build a smart environment. So this smart space, this smart environment, shall be allowed that there's an easy and flexible setup process and save the cost. And also we can have real-time environment in management and the data analysis. So now the space thing is done, but we believe that a human-based care environment cares not only the space, but also the people who live inside. So we have taken one step forward. We're going to do an Ultron Care solution. So this solution includes physiological measurements and accident detection. And also, we can offer real-time report to all the family members, and there's no upgrade cost, which means you don't have to do like no integration work on hardware and also software. So the idea is kind of the same of what we talk about the smart space. So we have worked with our hardware partners such as the physiological measurements devices and also the fall detection devices or like bed pass sensors. So all these partners devices, they can transfer the data to our cloud and to our apps. So in this app, the user can share their data to their family members. And once the member is scanning the QR code of the users, they can do the scheduling. And they can have like real-time report to know that whether the measurement task is completed or not. And today's, whether the user's health condition is okay or not. And if they go to a doctor's, they can export the measurement history as a clinical reference. So now, if the family members are living away from the elders, they can still know like whether their condition is good or not and when to pay attention to. So now we have covered the space and also the people. Now you can have a very integrated care space here. We have the smart appliances and sensors, and we can have like a detailed management platform that can help us to know like whether the people we care of is fine or not. So now we have like a lot of validation from our hardware partners, integrated the devices from the space, and also like that helps to know people's health conditions. And we have like successful cases in building the smart space. And now, since we have the UltronCare solution, we know that we can use our connectivity technology on this smart healthcare business to upgrade the whole industry, to make everything connected. So we can really build an ideal care home and space experience to the people. Thank you.